Hafide, and welcome back to Healthy Living. The medical team from the Shriners Hospital for Children out of Honolulu, Hawaii is back in Guam this week to provide free consultative medical services. I'm here with Hospital Chief of Staff, Dr. Craig Ono. So, Doc, what can you tell me about this ongoing clinic?
Well, we've been here since last week, Wednesday, and we've been seeing clinic here at Guam Public Health. I have a team of 3 care providers. I'm a pediatric orthopedic surgeon, and I have a partner who's a pediatric orthopedic surgeon who's the former chief of staff at the Houston Hospital. And then we have a nurse practitioner who's providing care. And every day we see about, I guess, about 50 to 60 children, and we'll be here through the end of this week.
Okay, so how many days total is this clinic?
Total, as far as clinic days, were 6 days. We had one day last week, Friday, where we would participate in a conference that was hosted by the Guam Public Health.
Okay, so can you kind of give us an idea of what kind of medical consultations are provided?
So I'm a pediatric orthopedic surgeon, so I take care of children who have congenital and acquired musculoskeletal problems, so problems of the spine, either the cervical spine or their other parts of their back. So children with scoliosis, for example. Children who have congenital birth defects or birth anomalies like clubfoot. And then children who have acquired problems, acquired traumatic or either from an injury, such as a sports injury or from a fracture, or if they have deformities due to infections.
Okay, are these serious medical conditions that we're talking about?
They can be. They can be. For example, an infection of the bone can be a very serious problem that would require extensive treatment at times.
Okay, so I understand that for this particular clinic, it doesn't have to be doctor referred. People in the community who feel like they have these kind of issues that could be, they could benefit from help from a physician or a consultation from a physician, they can self-refer also?
They can self-refer, so they don't need a physician referral. They just need to contact Guam Public Health and we'll make arrangements to see them.
Okay, well, if people want to, they do want to participate in a consultation, what kind of documents should they bring?
Well, they should bring their birth certificate and any immunization record that they have. And they just need to present themselves. If they have any medical records or if they've had evaluations done elsewhere, that's helpful too for them to bring in.
All right, so I understand that this is something that the Shriners Hospital out of Honolulu, Hawaii does on a yearly basis. It's something that has been kind of ongoing. Can you tell me why is it important to reach out to people in the community and provide these kind of services?
Well, we provide services throughout the South and Western Pacific area, so not only in the state of Hawaii. About 2/3 of our patient population in the state of Hawaii, and then 1/3 of our patient population is in all these is throughout the South and Western Pacific areas. We've been coming out to Guam since the 1950s. We visit twice a year and hold these clinics, and it's an underserved area with regards to pediatric orthopedics, and we're fortunate enough to be able to do this, to be able to provide the access to pediatric orthopedic care and hold these clinics.
You know, parents already have enough on their plate having to provide for their children. Medical services or medical issues are just one more thing, one less thing that can be taken off their shoulders. So I understand that the actual consultations are free of charge, but for those who might require a little bit extra medical attention, what are their options?
Um, so for children who require, for example, physical therapy or rehabilitation services, we'll complete the prescription and the patient or their families are referred to their private insurer or their insurance company with regards to receiving those services and payment for those services. For children who require treatment, surgical treatment, we and if the family wants us to treat them with their surgery, then we bring them to Honolulu for that care. And that care in Honolulu is done regardless of the ability of the patient or family to pay. And if needed, the Shriners Fraternal Organization, so the Shrine Club out here in Guam, will help subsidize the transportation costs for the patient and the family.
All right. Well, I understand that this is, a project that you've been participating in for several years. Can you tell me, do you have one, memorable experience you can tell us about?
Probably not just one, but I can tell you it's just wonderful being out here. The first time I came out here was about 25 years ago. And I've been working full time with the Shriners hospitals for children in Honolulu for the past 15 years. So I've watched kids grow up. I've watched kids who've had significant problems, who've been able to, for example, a child who could not walk when I initially took care of her and was told that she wouldn't be able to walk, but lo and behold, she got up and she walked across the stage for her high school graduation ceremony. Well, those are such great times, and the parents will bring in those videos, and we'll share that joy when they do. There's so much fun taking care of the kids, and it's a great time being here in Guam because the families are great and the kids are great to take care of.
All right. Well, thanks so much, Dr. Ono. I know here in Guam, everyone in the community is very appreciative of the work that you do here. Well, stay tuned. We'll be back to wrap up the show after the break.
Your community calendar is brought to you by Taco Bell. Whether it's your first meal or your fourth meal, we've got you covered. Taco Bell, live Mas.